Now we shall move to describe the lateral aspect of the skull, or Norma lateralis. This is the zygomatic arch. It extends anteroposteriorly in the side of the skull and separates the temporal fossa above from the infratemporal fossa below. It is readily palpable under the skin, and its upper border corresponds to the base of the cerebrum. Its lower border gives origin to the masseter muscle. This is the temporal fossa. It is bounded by the temporal line from above and by the zygomatic arch from below. The temporal line begins anteriorly at the zygomatic process of the frontal bone and then arches across the side of the skull to end posteriorly by joining the supramastoid crest, which is a ridge above the mastoid process. The temporal line gives origin to the temporal fascia, which is deep fascia covering the temporalis muscle. The temporalis muscle itself arises from the whole floor of the temporal fossa, and its tendon passes deep to the zygomatic arch to get insertion into the coronoid process of the mandible. The temporal fascia is attached below to the zygomatic arch. The floor of the temporal fossa is formed by 4 bones: the frontal, parietal, squamous temporal, and greater wing of sphenoid. These 4 bones articulate together at the pterion, which is an H-shaped suture. The pterion is of surgical importance as it overlies the frontal branch of the middle meningeal artery. The pterion is demarcated on the surface by a point that lies at 4 centimeters above the midpoint of the zygomatic arch and 4 centimeters behind the zygomatic process of the frontal bone. Injury to the middle meningeal artery results in an extradural hemorrhage. This is the infratemporal fossa. It lies below the zygomatic arch and behind the maxilla. The ramus of the mandible limits the fossa laterally, while the lateral pterygoid plate of the sphenoid bone limits it medially. It has the following communications. First, with the temporal fossa through the gap deep to the zygomatic arch. Second, with the orbit through the inferior orbital fissure. Third, with the pterygopalatine fossa through the pterygomaxillary fissure, which is a gap between the back of the maxilla and the lateral pterygoid plate. The infratemporal fossa contains important structures. The lateral and the medial pterygoid muscles, the maxillary artery, the mandibular nerve, the pterygoid plexus of veins. This is the pterygopalatine fossa. It is located between the pterygoid process of the sphenoid bone and the palatine bone. It contains the maxillary nerve, which crosses the fossa after it emerges from the foramen rotundum to enter the infraorbital fissure. The pterygopalatine ganglia is suspended from the nerve in this fossa. Furthermore, the maxillary artery ends inside the fossa, where it gives off many branches. This fossa communicates with the nasal cavity through the sphenopalatine foramen medially, with the infratemporal fossa through the pterygomaxillary fissure laterally, with the orbit through the infraorbital fissure anteriorly, with the middle cranial fossa through the foramen rotundum posteriorly, with the palate through the greater palatine canal downwards, with the pharynx through the pterygoid canal posteriorly. This is the external auditory or acoustic meatus. The floor, anterior wall, and the posterior wall of this meatus are formed by the tympanic plate of the temporal bone. Immediately above and behind this meatus, there is the suprameatal triangle, which is bounded above and in front by the supramastoid crest, anteriorly by the postero-superior edge of the external auditory meatus, and posteriorly by a line tangent to the posterior margin of the external auditory meatus. This triangle overlies the mastoid antrum, which is a cavity present just posterior to the middle ear and communicates with it through an adytus. This is the mastoid process. It is a part of the temporal bone and is filled with air spaces called the mastoid air cells. The mastoid process is absent at the time of birth and develops by the second year, and as a result, the stylomastoid foramen gets a deeper position and the facial nerve emerging from it becomes shifted away from the surface. The facial nerve is exposed to the danger of cutting in incisions just behind the ear in infants. The outer aspect of the mastoid process gives insertion to the sternomastoid muscle, while its deep aspect gives origin to the posterior belly of the digastric muscle. The mastoid process is more prominent in the male than in the female, and is used in sexing the skull, as the case with the prominence of the superciliary arches. This is the styloid process. It is a part of the temporal bone that projects downwards and forwards from under the cover of the tympanic plate. It gives origin to 3 muscles and 2 ligaments: the styloglossus muscle to the tongue, the stylopharyngeus muscle to the pharynx, the stylohyoid muscle to the hyoid bone, the stylohyoid ligament to the hyoid bone, and the stylomandibular ligament to the angle of the mandible.